Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from
Okay, welcome back. Like I told you yesterday when we started this 24-hour online conversation, I said I am doing it, to mark my birthday. My birthday is on 21st of August. It is Friday. All of you must mean something. If you have my personal number, that is my PAMPay, OP, Kema Fowos. And I don't want to hear happy belated birthday because that's why I'm going to be in the office on Friday to collect gifts from all of you. Yes, over where you can tap. Baba is begging up for something online. I don't care. If I no beg from you, you know you people are helping on this one. And I did a video, and in that video I was responding to a question by somebody that, Baba, why don't you bring your success story to online? And I was replying that person in that video, responded to that person in that video that people who are coming to my clinic knows the number of pregnancy which I achieved this year. So for all of you that you are pregnant this year in my clinic, Friday, 25 Olowu Street, besides any bank, your gift must drop. No problem. Now with me in the studio, I know you are seeing a young woman on the other side of me. You are in, say, Pupalema 21 wine. This is red. It's a red wine color. Madam, could you please introduce yourself to us?
Okay. Thank you very much, sir. And excuse me. Happy birthday in advance.
Okay.
We are coming for the party. So my name is Mrs. Adebola Adeyeloja Olusonya. I'm the managing director of AAA Medicalibrations Limited, where we partner with clinics to complete families.
Wow. Yes, I like. Yes. I've known Bola, let me put it that way. I've known Bola for many years. And if I tell you, AAA Medical Calibration Limited, they are a company that is known for quality, and they are known for a good service. When you come to anything you need in assisted reproductive technology.
Yes.
MD.
Yes, sir.
Now, let me ask you now, for some of the clinic that is they're online, that they will see this video where we are going to post it, or those that are watching us now.
Yes.
If anybody want to open IVF clinic, does he need to break the bank before open the IVF clinic?
Yes and no.
Okay.
Yes, because And also, because of the specialty of assisted reproductive techniques, many of the products that are used are probably a little bit more expensive than what is used in general laboratories.
Okay.
And so if you are opening a general lab and you're opening an IVF lab, you cannot really compare the costs.
Okay.
Because for IVF labs, the equipment, the consumables need additional certifications and testing.
Okay.
Because these are products that are going to be cultured in those equipment and consumables,
Okay.
and then transferred into the human body.
Okay.
So both the manufacturers and we ourselves need to be sure that for that process to happen, everything has to be certified for use inside and outside the human body.
Okay.
So that's the breaking the bank.
Okay.
The not breaking the bank is that we, as I said, we partner. And because we partner, we do not make the process difficult for anybody. So reaching out to us, we can sit down with the clinic and agree on how much do they have, how do they want to pay, how do they want to purchase.
Okay.
And we can also recommend to them. And we handle it from design up until even when they are running.
Okay.
Yes. Thank you,
Okay.
sir.
MD, I want to know, for how long have you been in business?
Oh. Well, by God's grace, next year we're going to be 15 years.
Wow.
Yes, we'll be
Wow,
15 years
15.
next year. Yes.
You've helped many hospitals, many laboratories, which mean to are part of is it for testimony or
Yes, testimony.
beneficiary. Better beneficiary, because let me put this online. I'm saying this not because I want to now start gaslighting you people or to start polishing a medical calibration unnecessary. No, there's something that happened because when I brought her, and I think you people, if you need their number, their contact, they will give you before they leave this show.
Yes.
Then you can still reach out to me. They help people to grow. That is what I can tell you. I want to give you my own testimony now. And I think it was in 2022. I told you we've known each other. We have been doing business together for a long period. But in 2022, you know, running business, doing business in Nigeria is not easy. It's not my mind. So, and that time things were was very, very difficult. Even when we send invoice request to them, say we need so thing. The only thing they will tell us, say, Emma gbagbe nte ejele, and they will still support us. We thank God that time we are not clinic then. We are just a fertility laboratory. But this company stood by us and they support us till we are now a registered and certified clinic in Nigeria. So I'm telling you, if I tell you that they help people to grow, not because they are on this show, I'm telling you my own testimony now. MD, I want to ask you now. Yes, you help people to grow. How do you survive in these 15 years? Because I can see that AA medical calibration is growing, and you people are servicing so many hospitals and IVF clinics in Nigeria. How do you survive? Because somebody was asking me yesterday that Bababu, let's say survive. How do you survive?
Well, we have survived by the grace of God.
Wow.
And we have survived because, as I said, we are partners.
Okay.
So we put our customers' needs first. We are highly oriented around customer service because we know that the service we render, not just directly, but also indirectly through the clinics, is we are helping people. We are helping people who are in need of, who have emotional need for children.
Okay.
We are helping them through the clinics to achieve their desires.
Okay.
So the first thing for myself and for our company as a whole is for anybody to work with us, we have to see that passion
Okay.
for the pain of other people in them. So by the time we get a new employee who is not passionate about people who are in pain, who does not care whether somebody is calling them at 10 o'clock or 11, the person cannot survive.
Okay.
All our staff, you can call them 8 p.m., 9 p.m., 10 p.m., 11, whatever, because we know that a lot of clinics, sometimes a doctor wants to perform a procedure or something, or he has been in the theater since morning. He's only free at 11, at 12. We are willing to receive their calls.
Okay.
We are willing to take their
That
requests.
means your after-sales support is top notch.
That is what we aim to achieve.
Okay.
Yes.
God will continue to expand you.
Amen.
Will you please tell us some of the company you partner with so that people that is watching you will know that this is not a local company. Yes, this is not a local. You know, when we let me put this online too, not because I'm gaslighting my sister here, but I want to tell you that they are international company.
Yes.
We went to history in what month? Last month,
July. Yes.
July. If you see the company this young woman is working with over there, wow. See, there's a particular section of that conference that you can't enter that section anyhow. Pre-Congress, whatever, and so on. Do you know that Bola take me that enter that place? Yes, it took me enter with those who invited. If you see my no. So please tell us those companies that you partner with, so that people could know that no, you are not just localized in Nigeria, you are international.
Yes. So currently we partner with a lot of equipment manufacturers, especially specific for IVF, like Vitromed is in Germany, Harriomed in China, Philips Biomedical in France, and so many more. Sunlight in UK, in US. So we have a lot of suppliers and manufacturers that we partner with in Europe, in America, in China, in India. So because what we want to do and how we partner with clinics is to look at everybody's budget and work things out according to their budget and specifications that are best suited for IVF and for Nigerian markets. Yes.
Okay, thank you. Could you please tell us how people that is watching at home can give us your office contact, out the address, how they can reach out to you?
Okay, so I can be reached directly on 081 6996 4214 via WhatsApp or direct call, even on Telegram. So, and we have offices in Lagos, Abuja, Port Harcourt. We also have customers all over West Africa. We sell into Ghana, into Benin, into Cote d'Ivoire, Senegal, and basically anywhere, even Tanzania. So we sell.
But you've not given us your head office address in Lagos.
Okay, our office address in Lagos is 2 Abimbola Close, Jibo, Lagos. Yes.
Now, what do you have for clinics, hospitals that they want to go into, or they are aspiring to have a IVF section, or they are into but they are struggling to survive? Do you have advice for them?
Yes. My advice for them is we are available for them, and we partner with clinics from beginning to the end. We also help clinics with revising their systems. So we have also helped clinics who, for one reason or the other, they've set up one way or the other and found out they were not achieving the success rates that they expected. So we've gone in with our own experts, because we also have senior embryologists on our platform, on our own network, that can go in and help and check and advise and consult to ensure that everything is running smoothly.
That means what you just said now opened my mind that means even if you have a good expertise, if you do not have a good setup, it can affect the outcome of the IVF procedure.
Of course.
So that is why you at your own end, you have your own embryologists,
Yes.
you have your own engineers,
Yes.
that they can come in and check the setup.
Of course.
So people, viewers at home, I want to introduce to you AAA Medical Calibration. The MD is here, Mrs. Adebola Adeyaloja Olusonya. I have known her for a long period, more than 10 years. So that means it's not that I brought him up here, I brought her up. No. And I can tell you, I can testify that they have a good product and their after-sales support is very good, which I'm one of the beneficiaries. Call them at any time. If you call them late in the evening, if they can't get to you that evening, I'm telling you, tell them the time you are going to open your office, your clinic, hospital, your laboratory, the following day, they are with you and they are going to sort out your problem. MD.
Yes, sir.
Thanks for coming.
Thank you very much. Thank you for having me, sir.
Any other time
and happy
you
birthday.
You will come.
Of course, of course.
So you are
of
welcome.
Course. Thank you very much, sir.
Man.
Thank you very much, sir. Yes, sir. Thank you.
Abim Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation.
Bye. I want to explain something about male infertility. That thing we call retrograde ejaculation. You know, when a man has sex with his wife, sperm cells will pass through the penis and it will be deposited inside the vagina. But in some men, when they have sex with women, when they have sex with their wives or spouse, when they reach orgasm, they will feel as if they've released. Normally, the way man will feel when they release semen. But nothing will come out of their penis. Then you keep finding out, you keep asking, where is the semen go? You know, there are some women too, which I don't know why, when their spouse has sex with them, some of their spouse, they are not releasing in them and they don't know. The only wetness in the vagina is the vaginal fluid that comes out because of sexual arousal. I want to get this retrograde ejaculation explained to you. Is a way of, instead of the sperm to pass through and to come through urethra and come out, it will go back to bladder, inside the bladder. The way God created anatomy of a man is when a man is sexually aroused, the bladder closes, the sperm go through it and go to the penis and come out. But in the retrograde ejaculation, the bladder won't be able to close and the sperm flow back into the inside the bladder. I want to tell you home test for you to know whether you have retrograde ejaculation or not. Home test. What do you need to do? Buy 2 tumblers. Very wide ring tumbler, 2. When you want to do this test, go and urinate. Urinate inside 1 tumbler, and put this one side. Then you keep that urine. Ensure that you empty your bladder. Let that tumbler, let the urine this up to close to the brim home test for you to know whether you have retrograde ejaculation. For you to know whether you have retrograde ejaculation, what you need to do, you go and empty your bladder. Mami, you pass urine inside the cup like this. You keep it one side. Then you take small water. Then after like 1 hour, you go inside and have sex with your wife. Then the next urine that you want to bring out, take another tumbler and put that urine. If that urine look as if like a pami, that means your sperm cells is going through inside bladder. That is how to test for retrograde ejaculation in the house. If you always have sex and you find out that you don't always release, retrograde ejaculation is a serious problem. So if you always have sex and you don't release, check whether you have retrograde ejaculation. You see that second unit that look like a pami, is because sperm cells are inside. You can take that urine, take it to the lab, let them check whether the sperm cells are there. If they have so many sperm cells that is there, then talk to professional. They know the right thing to do for you, for your wife to get pregnant without surgery. God will help us. My name is Ujo Adekende Samuel. I'm a practicing fertility scientist, a brand ambassador for Fertility. Till I come your way next time. God is good. Bye.
Abim Fertility and Andrology ló tún gbára ọ̀tọ̀ dé o. Ọlọ́tọ̀ ní tòun ọ̀tọ̀, bẹ́ẹ̀ ni ọ̀tọ̀ ní títọ́lú, ọ̀tọ̀ ní títọ́lú, ọ̀tọ̀ tún ní títọ́lútọ́lú. Pẹ̀lú ayẹyẹ ọjọ́ ìbí bàbá wa, Abim Fertility and Andrology, Ambassador Kehinde Samuel Wojuade, fertility scientist and chief executive, Abim Fertility and Andrology, 28 years experience in reproductive health. Àwọn ni wọ́n máa gbára ọ̀tọ̀ jáde. 24 hours fertility chart, first of its kind. A continuous 24 hours live session dedicated to answering your burning fertility questions.
Okay, we are back again, and like I promised us that we have some professionals, expertise in the field of assisted reproductive technology. With me now is one of professionals, an expert in fertility when it comes to assisted reproductive technology. Sister, good morning.
Good morning, sir.
How are you?
I'm fine,
I want
sir.
to call her sister so that she can feel at home on the set. And because I remember when we invited Dr. Oladejo yesterday after the show, Dr. Oladejo said, tension, just calm down. So that one, say, well, good morning, sister. Could you please introduce yourself to audience?
Okay, good morning, sir. Thank you for having me here. My name is Dr. Salako, and I'm one of the doctors working at the IVF section of Abim's Fertility.
Yes, Dr. Salako, you are welcome. we want to discuss IVF and challenges of IVF. I want you to tell us what is in vitro fertilization process. Please, just take us to explain the process to us, and very short, take us through the process from the start to finish.
All right, sir. Okay, so IVF, in vitro fertilization, is one of the artificial reproductive technologies that we have, and what it entails is basically taking human gametes, that's egg cells and sperm, from male and female, and then taking them to the lab to create an embryo, after which it is then transferred into the woman. So the process involves series of medications. For the woman, she will take a lot of medications to help with stimulating her ovaries, because you are taking over a natural cycle now. So you give her medications to superimpose to stimulate her ovaries. When the follicles are mature, you take her to the theater to do something that is called egg retrieval, like aspiration. You're going to collect the eggs, basically. And then the husband will produce his own semen sample, and then you take it to the lab, develop an embryo, and transfer it back a few days later. So that's basically the summary of what IVF entails.
Okay. Now, is it every woman that can do IVF?
So there's an age limit currently for IVF.
Okay.
So once you're above 53,
yes,
you can't go through with IVF again.
Okay.
Yes.
And if you're on the live chat, please help us power tap and share, because from TikTok that I'm using to monitor here, we are okay. We are yes. Thank you. I'm seeing it now. Please help us power tap and share. Let it go around for people to look at us online. What we are discussing now is IVF and challenges of IVF. I just asked Dr. Salako now, can every woman do IVF? Say no, there's age limit. And the age limit is 53. So now, what are the things you look for when you want to tell a woman that your case, you can't get pregnant naturally again? Now your case is IVF. What do you see before you advise a woman that way?
Okay, so first of all, before anybody can directly jump into IVF, there must be a case of non-patent tubes. That means the fallopian tubes are blocked.
Okay.
So she can't conceive naturally or through IUI. Secondly, before I tell a woman to go and try IVF, she must have been doing repeated IUI cycles and we're not achieving any success. Okay. And thirdly, even with patent tubes, you're just not achieving natural conception. Would recommend IVF for you as an alternative and option.
Okay. Now, in IVF, one of the things that women don't like in IVF, apart from the outcome of the process, one of the things is when you start advising them, you can't use your egg. Every woman wants to carry her baby with her egg. What are the conditions, or what will you see before you not tell any woman that you cannot use your egg for a procedure?
Okay, so what you just said is very interesting, because we see a lot of patients, they are so distraught when you tell them that, oh, you can't use your eggs. And we share your sentiments, but we also want the best for you. We want you to achieve pregnancy, we want you to carry pregnancy. But in situations like an advanced age, where your eggs are no longer as good as they used to be when you were younger, we would counsel you to use donor eggs. And it's not that even donor eggs guarantee 100%, but there's a higher chance of success.
With Abim's Fertility and Andrology.
For a younger woman, the quality is still very good. Even if you are older and you even do a test to check your ovarian reserve, the fact that it is good does not guarantee that the ovarian reserve is, that the quality of the egg is good. So if you are old, above 35, we counsel you to use donor egg because of the quality. Number 2, if you have conditions like PCOS, we counsel to use donor eggs because of the quality also. Because again, in IVF, the success is dependent on the quality of the embryo that you get. which is then dependent on the quality of the egg cells and the sperm cells. So if we are seeing a case where you are not your age is advanced and then your AMH is low, that's your ovarian reserve is low, and then you have conditions like PCOS, we usually counsel people to use donor eggs.
Okay.
But people with religious sentiments, they still are hell-bent on using their own eggs, and eventually we see the outcome. It's not always something nice,
Okay.
because you've counseled them already and it's like we don't know what to do again. But that's the situation where we usually counsel for people to use donor
So
eggs.
that means in some cases you see people that you will cancel them against using their own egg, maybe because one is on the other, but they will still go ahead based on religious sentiment.
Yes.
Then what if they do not have egg? What will you people do? Let's say they do not have egg. What will you people do?
We'll tell them
And cancel the
the
procedure.
procedure, yes.
Okay. Now, if somebody is asking here that, please, if you are joining this live, help us share, power tap, and subscribe to our YouTube and Facebook channel, and add us as a friend on TikTok. Now, somebody is asking here that if your husband has a low sperm count, can still go for IVF, will it be successful?
Okay. So it depends on how low the sperm count is.
Okay.
Because there's something called ICSI that they can
Okay.
use to help low sperm cells.
Okay.
Exactly. Someone that has low sperm count. So
Okay.
it depends on how low it is. There's a particular level where we recommend people to go for sperm retrieval instead of trying to use their own sperm.
Okay.
So it also depends on the motility of the sperm cells and how low it is.
Okay.
So
But the aspect is, will it be successful? That's what he's asking.
there is no guarantee with IVF. Even when the
Okay.
sperm cells are fantastic and 100%, you still can't
Okay.
guarantee the outcome. And there are
Okay.
people with low sperm count that get
Okay.
pregnant.
Okay.
So with IVF, it's a thing of chance.
Okay. So now another person is asking here, before I ask my question from you, he said person will get low sperm count and hepatitis want to go marry second wife, but I didn't really find out. That one is not a topic to be discussed here. Now, you said IVF is not guaranteed because why do you say so?
Okay. The reason is because of there's a part of IVF that I usually tell patients that nobody has control over,
Okay.
and that is the part of implantation.
Okay.
So implantation is dependent on the embryo, is dependent on the uterus.
Okay.
So even sometimes when the uterus, that's the womb lining is fantastic, you still are not sure that those embryos will implant. So that implantation part of IVF is the part where we don't have control over. That's why we always say that
Okay.
IVF is not guaranteed.
Okay. Okay. Thank you. So now that we've known now that there's aspect that you can't have a control. You can control every other processes, but that aspect is difficult to control. So if a man has a good embryo and is being transferred and there's no result, there's no implantation, no results, what will you do if the first attempt the procedure is negative? What will you counsel the patient?
Okay, so if you've done an IVF and the first attempt is negative, usually we counsel patients to try again if they can afford it, because there's something we say in IVF that the more you try, the likely you are to succeed, because you won't know if you will succeed if you don't try again. So we can't have a failed attempt the first time and then we just give up.
Okay.
We're trying to achieve results here, so we counsel them to try again
Okay.
if they can after a few months.
Okay. I want you to explain to us the importance of good semen analysis in IVF
Okay.
as regard to outcome of that process.
Okay.
Do you think semen analysis is enough to evaluate any man for us to have a good result in IVF?
Okay, so semen analysis, it's not enough. There's something else that can be done to really check the DNA composition of the sperm cells, and that's called DNA fragmentation test. It goes beyond looking at just the sperm with microscope on gross appearance. DNA fragmentation test would go directly to check the DNA components of those sperm cells, because if there are too many DNA fragmentation, it can affect the outcome of fertilization. Yeah, so there's DNA fragmentation test that can be done apart from semen analysis.
Okay, so that means you are saying that it is not enough for a man to do semen analysis.
Yes, especially if you're having recurrent failure.
Recurrent failure. So if, apart from, you told us at the beginning of this conversation that there's age limit to IVF. So what are the other things a woman could do to get her own child if her age past 53, as you told us at the beginning of this conversation?
Okay, so there's something called surrogacy that a woman can do. Surrogacy is a process whereby you look for someone to carry the baby for you, using your own husband, either using your own husband's semen and a donor egg, because of course at that age the woman will not be able to use her own eggs again. So they'll get the embryo, look for a surrogate that has given birth before, that's achieved pregnancy and has given birth before. Look for that surrogacy and use a uterus, especially if everything is fine, no fibroids, nothing, clear uterus, you use her, and then she'll be able to achieve her own pregnancy through that route.
Okay, thank you. Then I want to find out, there's something we call sonohysterogram in IVF. There's something we call hysteroscopy in IVF. Could you please explain the differences between these processes?
Okay. Sonohysterogram is the procedure that entails you checking a woman's cervix to check the patency, that is whether it is open or not, because of course if you want to do IVF you need the cervix to be open, because that is the route they're going to use to pass the embryos. So sonohysterogram will assess the patency of the cervix, and then it will also check the uterus, the endometrium, how it can dilate. But hysteroscopy, it's more advanced. What it's doing is to check at a more tiny and microscopic level the things that are inside the womb lining, things like polyps, things like adhesions. Apart from it checking it, hysteroscopy will also help to correct whatever it is that is wrong. But sonohysterogram will only check the cervix and then check the uterus. That's all about it.
Okay. Now, we are talking about IVF and its challenges. What are the challenges of IVF in Nigeria?
Okay, so one is finance.
Okay.
Yes. A lot of people want to get pregnant. They want to do IVF, especially for people that are young. But finance can be a stumbling block. Do you understand? So people that are young and are trying to conceive most times want to look for options and things that they can do to give them results as soon as possible. But money stands as a stumbling block. Even in people that are older also. That's why you see people, they will have waited for 15 years. It's not that they don't know that there's IVF. Some of them just cannot afford it. So funding is one of the challenges of IVF. Number 2 is the issue of, like we said, the scientific part, the egg quality, the sperm quality. Some people are hell-bent on using their own gametes to achieve pregnancy. And in a situation where the quality is not great, you cannot guarantee a result. Even when the quality is great, you still can't guarantee. Not to talk of when the egg is not good, the sperm cells are not good, you are older, and they are telling you that please try and consider using donor egg. These are the challenges. Patients' sentiments come into play a lot when it comes to IVF. I think those are the challenges that I see and have encountered. Number 3 is the negative outcomes. When patients have negative IVF, it's usually it weighs us down a lot. We hate to do failed cycle review. We just want to see people getting pregnant and getting pregnant. But when people have failed cycle, the emotional outburst and challenge is usually overwhelming. So those are the challenges that I've seen so far.
Okay, thank you. God bless you. Now, there are some women or couple, when they want to do IVF, they want to select gender. I want you to throw more light on this.
Okay.
Gender selection in IVF.
Okay, so gender selection in IVF is a thing that is done, but it is more expensive than regular IVF. It's called pre-genetic testing. They will use to select the specific sex that you want. It's almost 100% accurate, but there's still that part of chance that might not give you what you want, but it is almost 100% accurate.
Okay.
Yes.
Okay, so is it like somebody was telling me the other time, let's say they have 3 girls and now they want to do IVF and they want to select gender for that IVF, but they want to make child now. Do you think it compulsory that when they create embryo, all the embryo will be what they desired and that they needed?
No. There's no guarantee with gender selection that all the gender will be what you want.
Okay,
like I said,
okay.
there's that chance. There's like 0.1 or 1% chance
Okay.
that might not be the gender that you want.
Okay. God continue to be with you people.
Amen.
So, what do you think about perception or perspective of IVF among the black people?
Okay.
What do you think the way they see it?
So I think that over the years, the perception has really changed.
Okay.
Especially people in religious settings now come out to say that, oh, I had my baby through IVF. Nobody is hiding again, as opposed to a few years back.
Okay.
People are now more open to the option of IVF and are no longer shy about it. So I think it's really something, it's good that people are more aware and are more open and are no longer sentimental about IVF. I think people are now more interested.
Okay.
Yeah, perception is good.
It's good now.
Yes.
Okay. I want to find out from you, with your experience and practice of long years in assisted reproductive technology, what would you advise? What would you advise a woman that has maybe any of the metabolic disorder and wanted to get pregnant?
Okay.
So let's say a woman has BP, high BP, sugar, heart problem. What would you advise those women?
Okay. So if you have underlying medical condition, it's not a total contraindication to say that you cannot get pregnant.
Okay.
All that needs to be done is for that condition to be controlled.
Okay.
Hypertension in pregnancy can be controlled. Diabetes can be controlled. They coexist with pregnancy and it can be controlled. So if you have it, just ensure that you are seeing a physician that can control and manage it together with the pregnancy if you get pregnant. And before you get pregnant, there are medications that are pregnancy safe that you can start taking before you now try to conceive. So it's not a contraindication to getting pregnant.
Okay. Dr. Salako, thanks for coming up on this show.
Thank you, sir.
On a last note, I want you to advise women, men, couples that are waiting on God for fruit of the womb. I want you to advise them.
Okay, so if you're watching and then you are trusting God, you are waiting for the fruit of the womb, my advice to you is to not give up. First of all, be resilient in your determination to want to get pregnant. Number 2, seek professional counsel. See a doctor, see a professional, seek counsel about your condition. Do investigations, know the state of your body. So some people are just waiting that God will answer me one day. Yes, true, God will answer you, but God also works with your works. The Bible says that faith without works is dead. So as you are waiting on God, do your own part by going for investigations, do your own part by seeing professionals, and don't just give up. Every person that does not give up on their vision or their goal eventually achieve success, no matter how long or no matter how delayed. So that's just my counsel for you. God will answer you one day. Don't give up.
Thank you for coming up on this show.
Thank you, sir.
We appreciate you. I hope when next we call you, you will answer.
Thank you, sir.
You are welcome.
Thank you very much, sir.
So now we are going to go on break, and shortly we'll be back.
A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening.
Ever remove pregnancy before? That is unwanted pregnancy. Because you know when you are doing it, you know you do not need it. And yet, you continue to say, baby, don't stop. Belle come, now go and remove it. You are now waiting on God for fruit of the womb. 3 things could have happened to you. 1, if you use medication to remove pregnancy, it could disrupt your hormones, make your hormones to be unbalanced after you remove that pregnancy. Secondly, if you remove that pregnancy with D&C, dilatation and curettage, the endometrium, the lining of your womb, called the endometrium, could have been severed, whereby that could result to aggression or scar tissue inside you. If any of this is found inside you, your womb will not get pregnant. When you remove unwanted pregnancy, or you know you've removed unwanted pregnancy, and you are waiting on God for fruit of the womb, submit yourself for test. Let them check you properly. I'm not talking about scan now. I'm not talking about follicular tracking now. I'm talking about hysteroscopy. When they do it, if there's a scar tissue inside you, or there is a address, I want to explain something about male infertility. That thing we call retrograde ejaculation. You know, when a man has sex with his wife, sperm cells will pass through the pelvis and it will be deposited inside the vagina. But in some men, when they have sex with women, when they have sex with their wives or spouse, when they reach orgasm, they will feel as if they've released. Normally, the way man will feel when they release semen. But nothing will come out of their penis. Then you keep finding out, you keep asking, where is the semen go? You know, there are some women too, which I don't know why, when their spouse have sex with them, some of their spouse, they are not releasing in them, and they don't know. The only wetness in the vagina is the vaginal fluid that comes out because of sexual arousal. I want to get this retrograde ejaculation explained to you. Is a way of, instead of the sperm to pass through and come to urethra and come out, it will go back to bladder, inside the bladder. The way God created anatomy of a man is when a man is sexually aroused, the bladder close, the sperm go through it and go to the penis and come out. But in the retrograde ejaculation, the bladder won't be able to close and the sperm flow back into the inside the bladder. I want to tell you, home test for you to know whether you have retrograde ejaculation or not. Home test. What do you need to do? Buy 2 tumbler, very wide tumbler, 2. When you want to do this test, go and urinate. Urinate inside 1 tumbler, and put this one side. Then you keep that urine. Ensure that you empty your bladder. Let that tumbler, let the urine this up to close to the brim. Home test for you to know whether you have retrograde ejaculation. for you to know whether you have retrograde ejaculation, what you need to do, you go and empty your bladder. Mommy, you pass urine inside the cup like this. You keep it one side. Then you take small water. Then after like 1 hour, you go inside and have sex with your wife. Then the next urine that you want to bring out, take another tumbler and put that urine. If that urine look as if like a pammy, that means your sperm cells is going through inside bladder. That is how to test for retrograde ejaculation in the house. If you always have sex and you find out that you don't always release, retrograde ejaculation is a serious problem. So if you always have sex and you don't release, check whether you have retrograde ejaculation. You see that second unit that look like a pammy, it's because sperm cells are inside. You can take that urine, take it to the lab, let them check whether the sperm cells are there. If they have so many sperm cells, that is there.
Oh yeah, it's another beautiful time with Abim's Fertility and Andrology in celebration of an icon. Ambassador Kehinde Samuel Wojuade, fertility scientist and chief executive of Abim's Fertility and Andrology, 20